Good evening, everyone. This is Mayor Shawyn Patterson Howard, and we want to welcome you to our edition of Sundays with Shawyn. It is February 14th. Happy Valentine's Day to everyone. We are not necessarily having a Valentine's Day show today, but we are talking about our health. And if you love yourself, you'll definitely make sure that you stay on here and get some critical information about the COVID vaccinations, the availability, information about education around COVID-19. We want to make sure that our community is educated, that you are informed, and that for those who are interested in taking the vaccination, that you know when, where, and how to go about getting it. For those who still have concerns, that we are able to direct you in the proper way to get the information and the education that you need to make the decision about getting tested. So please take a moment at this time to share the video, so that your friends and family can get this information in real time with you. Tonight, we have some very exciting guests. We have here tonight with us Dr. W. Franklin Richardson, and he is the senior pastor of Grace Baptist Church here in Mount Vernon, as well as in Port St. Lucie, Florida. We have our executive director of our Mount Vernon Neighborhood Health Center, Ms. Judith Watson. We also have Mr. Charlie King. He works with Mercury, but he is also one of the founding members of the New York State Black Task Force on COVID Equity and Education, especially around the vaccinations. And we have our wonderful Deputy County Executive, Ken Jenkins. You know, each of these individuals are so powerful in their own right that you never know who to introduce first, but we have these wonderful guests with us. We want to share with you right before we get started and jump into the meat of our discussion, just some updates on where we are right now with COVID vaccine statistics in the city of Mount Vernon. So Danny, if you'd share. So right now we have 627 active cases of COVID in Mount Vernon. And what does that mean? That means that these are people who've tested positive within the last 10 to 14 days and are still under some level of quarantine. We had 30 new cases on February 11th, right before the holiday came. And so far, since March of 2020, Mount Vernon has reported 6,843 confirmed cases of COVID. From working in public health for over the past 30 years, I know that those numbers, while they might seem high, are actually low, because we know back in March, April, May, June, it was very difficult during the first wave for people to even get a test. So we would anticipate that those numbers are probably 2 to 3 times higher than what we are able to report. But those just are historical numbers. We know right now we have 627 active cases. Next slide, Danny. Here is some testing history that you see here in the city of Mount Vernon when it comes to the Mount Vernon Neighborhood Health Center. They're one of our state COVID testing sites. Back in January, they had a 3.4% positivity rate. And mid-January, after we saw New Year's and things of that nature, those celebrations, that rate went up to 15.3. And it started going down to 14.7. We had another spike in cases at the end of January, where we had about a 20% positivity rate. And now we're seeing our positivity rate drop in the city of Mount Vernon at the neighborhood center to less than 10% at 9.8. You know, this is definitely coincides with what we're seeing statewide and nationally. We are seeing people going to get tested, but we're seeing some of the positivity rates go down as the holidays have passed and people are still doing social distancing and following COVID protocols. Our overall testing rate at the health center has been 7.3. Now, there are other places where people are tested, but we know at the Mount Vernon Neighborhood Health Center, so because they test only Mount Vernon residents, that is the clearest indication of what COVID looks like amongst Mount Vernon residents. Some of our urgent care centers and doctors are testing people from different communities, and they don't necessarily separate their data. So with that being said, I want to bring our guests in, and we're going to start off with our Dr. Richardson. Dr. Richardson, if you could just introduce yourself and share with us quickly why you're here, then we're going to follow with Mr. King, Ms. Watson, and Mr. Jenkins, and then we're going to jump into our conversation.
Yeah, I'm Franklin Richardson, Senior Pastor of Grace Baptist Church I'm delighted to be here tonight with our mayor, who's doing a great job of navigating the city through this difficult time, as well as my colleagues, Ms. Watson, who is tremendous at the health center, Charlie King, who's been a fixture in addressing issues in our community, as well as Ken Jenkins, who's our county. So it's a marvelous panel gathered by a great mayor whose heart is sensitive to the people of Mount Vernon. I'm glad to be here. Thank
you, Dr. Richardson. Mr. King?
Yes, Mayor, first of all, I want to thank you for your leadership in Mount Vernon. I'm great to be here with my pastor, even though I am not in Mount Vernon. Dr. Richardson is the pastor for so many of us, and Ken Jenkins is a leader not just in Westchester, but for all of us across the state. And I don't know Ms. Watson, but I hope to get to hear more about her during the course of our discussion today. So thank you so much for inviting me to be here today.
Thank you so much. Judith? Oh, you have to unmute yourself.
Oh, wow.
There you go.
Okay. Sorry about that. Good evening, everyone. My name is Judith Watson. I'm the CEO of the Mount Vernon Neighborhood Health Center. As many of you know, Health Center has been in this community for over 50 years. And so I'm very, very pleased to be a part of the discussion this evening. Mayor Patterson, thank you so much for your leadership. And I'm pleased to be a part of this esteemed panel and look forward to the discussion around COVID, which is timely and very much needed.
Thank you so much.
Thank you, Mayor Patterson Howard. It is certainly a pleasure to be here. I'm Ken Jenkins, Deputy County Executive. We've been in this particular COVID fight from the very beginning, back from March 3rd, when we got the phone call that we had our first case here in Westchester County. We had the first containment area, the first East drive-through testing site, and our county center has been changed to be a vaccination site as of this moment. I am so privileged to be here this evening with Dr. Franklin Richardson. He's not my pastor, but he's all of our pastor, and we expect all the great work that he continues to do in his leadership role. Charlie King, a friend for so many years, but as Mayor Patterson Howard mentioned, a leader, and it was so kind to mention me as a leader, but Charlie King is a leader. And Charlie King is a leader for our Black community, for our Black issues, and he continues to raise his voice, and he has direct contact to be able to make that voice heard with the governor of the state of New York, Governor Cuomo. And then certainly Judith Watson doing an outstanding job at the Neighborhood Health Center, which Greenberg, Mount Vernon, Yonkers, wherever they are, they're making sure to get those the testing, the vaccinations, and work with everyone in the community. So I'm glad to be here this evening and look forward to this conversation on this esteemed panel.
Thank you. Thank you so much. So, Mr. King, I know that you're not able to stay with us for the entire time. So I kind of want to start out with you and speak to you about why you became involved locally and nationally around the discussion of COVID education and vaccination and equity. What sparked you to develop that concern and then activate yourself to partner with others?
So it really sort of stemmed from a number of conversations with the governor and with leaders like Dr. Richardson and Ken Jenkins right around the end of November. And this is around the vaccines, the beginning of the vaccine. The governor recognized that at the time President Trump was rolling out the vaccines, and he was doing it the traditional way, which the traditional way was to do it through the usual healthcare delivery process. And the traditional healthcare delivery process was almost to do sort of the definition of insanity, which was the definition of insanity is doing the same thing and expecting a different result. You're doing it through a healthcare delivery system that creates, as the governor says, these healthcare deserts, which means that Black, brown, and poor, and those in rural communities as well, would not get the vaccines. We know the numbers. Black individuals, African Americans in our communities, have died at 2.2 times, 3 times the rate of whites in New York, Latinos at 1.6. And so the question became, first, how do you do this differently, right? How do we create a vaccine distribution program that would be fundamentally different so that we could get access? And the answer is actually far more complicated than you think. You actually have to create an entirely new distribution system, and that's something that Dr. Richardson will talk about in greater detail, I think, and Ken and others can talk about. But Dr. Richardson is on the front lines of trying to figure this out with Grace Baptist and others. How do you build this out so that you can bring the vaccines to the community, to community centers, because that doesn't exist right now. So that's one part. And then how do you build the trust? Some say vaccine hesitancy, but it's also building the trust to overcome that in our community in particular. So Reverend Sharpton, Mayor Morial from the National Urban League, and Senator Nina Turner, who many people know from being the co-chair of the Bernie Sanders campaign, former state senator from Ohio, they created a national task force, but came to New York because there was so much work, so much leadership, like Dr. Richardson, Reverend Sharpton, and Mark Morial, who's here, to create this national model, to try to get it right here in New York and then replicate it to use it as an example for the other 49 states. So that's the short version of it. Dr. Richardson can talk about it in greater detail about some of the things that we need to overcome to get it right here in New York so that we can do it right. I would say that even with all the bumps and hiccups that we have as we're starting to get it going, we are light years ahead of other places in the country, which is the good news. But this is an incredibly large undertaking. It's, as the governor said and other leaders have said, this is the biggest undertaking that government has done since World War II. It's a vast effort to do it and do it right.
Mm-hmm.
Thank you so much. Thank you for, being willing to take that leadership nationally. I had an opportunity on last Wednesday to meet with the African American Mayors Association, and we met via Zoom with Vice President Kamala Harris and some of the White House task force on vaccinations. And the conversations that are happening here in our area, Westchester, New York, are happening all around the country, is how do we get access to the vaccination? When do we know when we're a priority? Why are there different people who can get access and others who can't get access? As you said, this is the largest undertaking of vaccinations in the country since World War II. And it's not just like the chickenpox vaccination or school vaccinations that kids go, or vaccinations that you get from birth to a certain age. We're trying to get everyone in the country vaccinated, but they've had to design and develop criteria for determining who were most at risk or most in need of getting the vaccine at the early stage and then rolling it out from there. And so that's where we are now. So Dr. Richardson.
Mayor, if I can just make one more quick point, I would also say that your thoughtful leadership on this has also not gone unnoticed. I think that you have been one of the leading mayors on your input on this as well. So as the plane is being built while we fly, flying the plane while we build it, like your thoughtful leadership on this also has been incredibly important too.
Thank you so much. I mean, I come to this job with 30 years of experience in public health, going back to working in HIV/AIDS in 1985. So, working in a public health space, working in a health equity space is what I did before becoming mayor. So it's really interesting that this would be one of the first challenges that I faced coming into office. As we said, we were one of the first sites that were hit and one of the first containment areas, being less than a mile away from Mount Vernon. And so we had to ramp up very, very quickly. And it wasn't just me, it was my team, and being able to reach out to people like Ms. Watson, our president and CEO, an incredible nurse over there at the health center, to partner with to get information on how we attack this. So nothing came on my own, but thank you for recognizing my passion and leaning into this. So when we talk about the, we know there was a 1A and then the 1B protocol all across, with the CDC, and then with the state and the county, we're all following the same guidelines. So 1A was the healthcare workers, and they were the first ones who were able to get vaccinated, followed up by first responders, those who were fire, EMS, and then moving down to police. And then, of course, they added seniors on next. How are we doing with that? And how is that being received in the different testing, in the different vaccination sites? How are people, how is the community handling that?
Maybe I can take that one. So let me see if I can simplify this. So 1A, as you said, were for healthcare personnel. The issue is that most organizations have only vaccinated about 30% of their workforce because of vaccine hesitancy and fear and concerns, right? So that's number one. Then when they expanded it to include essential workers, there weren't enough vaccines, right, to get everyone vaccinated. Then it was expanded to folks who were 75 years, and then, of course, they expanded it to include folks who were 65 years. Again, there weren't enough vaccines, and there still aren't enough vaccines. And now, effective tomorrow morning, or I think maybe it's midnight tonight, it's February 15th, so it's midnight tonight, they've now expanded it to include folks with underlying conditions. So millions of people meet the eligibility for being vaccinated. However, we don't have enough vaccines to vaccinate those who meet the eligibility criteria. So that's the crux of the issue, right? And there's a lot of talk around vaccine hesitancy and fear and concerns, right? But as you and I discussed this offline, Mayor, there are a lot of Black and brown people who want the vaccine. Can we start with those people? Let's give it to those who want it, right? And then let's move on to those to try to convince them. And it can be done simultaneously, but let's try to get the folks vaccinated who want the vaccine.
And Mayor, can I add in there? So certainly, one is we still recognize in all of your leadership, specifically with the African American mayors across the country, and certainly from day one, you've been on point on this. And Charlie has been a voice, as well as Dr. Richardson, a direct voice in Governor Cuomo's ear to see the differences. Judith Watson just talked about exactly what the main problem is. There are plenty of people that want to take to get the vaccine. We absolutely had to continue to do that education. There was vaccine hesitancy, and there's still some vaccine hesitancy. People want to see someone else get that vaccine first and see if they're okay. Where we've been past that particular point. Right now, it's a problem that there's just not enough vaccine. And in the previous federal administration, there was just a lack of leadership. In New York State, Governor Cuomo had to help and take that level of leadership for each one of the states to do the things that they have to do. And again, because of Dr. Richardson, because of Charlie King, because of Mark Morial, because of Reverend Sharpton, because of all of those voices out there that said the challenges in the community. And again, here in the county, with County Executive Latimer and all of our team, we're partners with the state. Everybody should be clear. The governor has executive authority, and he has the way to distribute the vaccines. And what we have seen through the process from going from 1A to 1B, and now to the extension, and just to clarify, is that started at 8 o'clock this morning, where people could register for the vaccine that had underlying conditions that were under 65, but they cannot start getting vaccinated until tomorrow. So people have been signing up for those between comorbidities and certainly immunocompromised individuals. There's a whole set of lists, and we continue to point people as a partner to the state website, the Am I Eligible website. I'm not sure, Mayor, if you're going to put those things up to direct individuals to do that and putting them in the chat and that kind of thing. But that's the process. The biggest challenge right now is there's just not enough vaccine to go around to all those individuals, and more importantly, to get them in the community that's necessary. And again, that's why people like Judith Watson and Reverend Richardson, you had a pop-up site happen because of people like Charlie King and Reverend Sharpton and Reverend Richardson and all the folks saying we got to get that in the arms of individuals that have had the most impact. And Mayor, because of your voice, to make sure we're getting the arms that control is necessary. I mean, all of us probably understand the technology a little bit better than the 65-plus-year-old individuals that needed to try to get vaccination appointments. That was a challenge. So now the best thing to do is what the governor has directed, and as happens is the pop-up sites are specifically in communities. They're in public housing. They're in places of worship. They're in our community centers where our folks can get the vaccine without having to go through all of the challenges and hoops of trying to get an appointment, because it is a tremendous challenge to do that. And again, kudos to the Grace Baptist Church, Reverend Richardson, Judith Watson, and Mayor Yu in the pop-up site in Mount Vernon. But we had 3 in Westchester, and all of them were targeted. And I can tell you, all of those pop-up sites were targeted to folks that were Black and brown communities in municipal housing, in public housing, in church organizations, in our places of worship, and more importantly, to get to those individuals that want to get the vaccine. And they were extremely successful, and I know that they're going to continue.
Can I jump in real quickly on these 2 points, because I think it's very, very important. And now that I know Judith Watson better, I think she's going to be a lead on all this, also, Mayor. But this is what's happening now with Ken, and the mayor is participating in this, and Dr. Richardson was doing this just yesterday. In about a month, I think, or 5 weeks, everyone talks about flood the zone, flood the zone. No one really understands what flood the zone means, but it kind of means that there's going to be thousands upon thousands, millions of vaccines that are going to be flooding into the state. Well, that's great. But what happens when they come into the state? Where are they going to go, and how are they going to be distributed? The answer is they're going to be distributed into a distribution process, which right now Dr. Richardson is figuring out how that's going to work. That's what Dr. Richardson was working on just yesterday. How is that going to work so that, I mean, pop-up isn't even the actual right term, because it's a sustainable mechanism. So it's going to be over not just days, but weeks. And so then at Judith Watson's place, it could be weeks. How does it sustain over weeks? So what the governor's team is working on, and what Ken is thinking about, and what the mayor is informing now, is how do we make this work so when we have 100,000 or 75,000 every week to distribute, how does that work? And to your point, Judith, you're exactly right. Let's get the people who want to get it. And I know that Dr. Richardson is going to talk about this, because, and Ken touched upon this, I'm a pretty successful guy. I'm 61 years old. I got health issues. I know I look better than Ken, but, I had some heart issues. I got asthma, but, I'm eligible. But it was intimidating to try to go on this am I eligible thing today. I almost like gave up, and I said, let me just wait till the 21-year-olds can do it so I can go. So imagine for people who even more, my wife had to help me do the whole thing. Imagine someone who doesn't have that, someone who's tech savvy. I mean, it's hard enough for me to even get online for this today. So for this broadcast. So the access point is very difficult. But Dr. Richardson and Ken are thinking about this when we have the bulk of it all. And that's the beauty of what we're doing here in New York under the leadership of some of the people that you have right here in Mount Vernon to get it right. But it's going to take about 3 weeks to 5 weeks to create that sustainability.
So one of the things that I believe to be what will be effective in our community, Mount Vernon has the opportunity to be a model for the nation. We are a densely populated community, but we are very small in size, 100,000 people in 4.4 square miles. We know each other. And so one of the things that we want to do over the next 4 to 5 weeks, as we're waiting for the vaccines to kind of flood our area, is to partner with different community organizations so that we can get that deep penetration and an organized penetrated effort into our community. So working with the churches, the church groups, the United Clergy, United Women, our Muslim, our Catholic churches, all of our different backgrounds and denominations, getting them to get the names and the information of people who want to be registered and who are ready to go. Like you said, working with those people who want to do it, our PTA associations, our neighborhood associations, our different cultural groups within the community. We know we have our Consul General Wilson, who works with the Jamaican population. We have our Caribbean community that works together, Brazilian, Portuguese, our Guardia Lombardi Association. So many of the cultural organizations, if we can really pull together a meeting of those leaders in a Zoom space, in a virtual space, and start getting information out to them, what information is required. I know when you had the pop-ups at Grace for the Health Center and Grace Baptist Church, we needed information on name, age, gender, date of birth, those things. And then we need to organize them as the different cohorts of people who become eligible come out. We need to, what makes you eligible? Is it your age? Is it your comorbidity? Is it the work that you do? So get that information also and organize those lists so that as the different groups become eligible and that rolls out, then we can really pull that information together and make sure that we're ready. Because the last thing that we want to do, what we experienced in Mount Vernon Hospital in the early stage is, as you said, Judith, only about 30% of healthcare workers wanted to get tested. But Mount Vernon Hospital's healthcare workers had already, vaccinated. They'd already been vaccinated over at Lawrence. And so Mount Vernon Hospital had the lowest vaccination delivery rate in the state of New York at 11%. New Rochelle was second. And so they've lost their vaccination site status and it's been given over to the county. But we have been hard hit. We are a community of color. We have a lot who are living in poverty, and 25% of our community is over the age of 65. And so we must make sure that we have our own points of distribution here in Mount Vernon so that we don't have to rely. Ken, the county is a great partner and we love you guys, but we have to make sure, especially the way we've been impacted here, that we have our own point of distribution sites. So whether it's Grace or the Neighborhood Health Center, or we do some type of larger site at the parking lot in Mount Vernon High School, wherever we're looking to do this, we need to make sure that when our community becomes eligible and the vaccinations are available, that we're ready to go. Because we don't want to scream and demand that they get here, and then when they get here, we can't deliver them quickly enough. And so I think that is the focus of what we are going to be doing over the next few weeks. And I definitely want to have deeper conversations with you. Dr. Richardson, Grace has been an anchor organization in the city of Mount Vernon for just over 130 years, I believe.
That's right.
And so when we needed test sites, and now when we needed vaccination sites, the governor, the county, the city of Mount Vernon, we have turned to Grace. Please talk to me about why Grace, why you as a faith leader, and you also have a community development corporation. Why is it so important for Grace to be not only involved, but really take a lead in ensuring that COVID is addressed here in the city of Mount Vernon?
It goes to our origins. Grace Church was organized by 5 African-American women who were former slaves. And that DNA has affected the church for 136 years. It is a DNA that makes us accountable to the community, accountable to the people we serve. We are a servant institution. We take seriously the theological implications and mandates of Jesus Christ to empower, to lift, to heal, to bring hope, and to bring healing. And so it's in our DNA. And so what I've done in these 40 some years that I've been Pastor Grace is follow that DNA. And that ended up having me involved in every issue that has come in our city, whether it's the school board issue, whether it's the first electing the first Black mayor of the city of Mount Vernon, whether it's whatever has lifted our people. That's what Grace has been about. And Grace has not been exclusive. I try my best to be inclusive. Grace is not trying to star. Many of the churches have come out of Grace, founded by Grace is the oldest church in Mount Vernon. And it has resources that accumulate, over time you accumulate resources. You accumulate members who have resources. You get a body of people. You got over 50 doctors who are members of Grace, and they make up a doctor's ministry. So you accumulate resources. The resources are for the people. When I got contacted by the governor to do the vaccine site and the testing site, I immediately called other pastors in the community and invited them to share. I said this yesterday, that what has to happen is we cannot allow a host pastor or host church to think that that's for them. They are simply a tool, and they have to invite all the pastors to be a part of it, so there's not any competition. This is too serious to be competing. This is too serious about making this your own promotion. This is about the healing of our people. And I believe that the issue is what has been said earlier. The issue is product, vaccines. That's the issue. We have the capacity to connect. If you make the vaccines available, our people are going to come get them. We won't have to have such strategic structures. They're finding their way. Our people find their way. People who want it are finding their way. They go as far as to way out in Queens and Long Island to get the vaccine because they are going to get it. Mount Vernon people don't stay in Mount Vernon. I got members of our church. They leave, if they find out Abyssinia got it, they're going down to Abyssinia and get it. So we don't have to worry about us. We're gonna get it. The key is that they got to flood the zone. They got to make the vaccine available because we need to eliminate these categories. These categories are not. They were meant because they were slow rollout. But we got to get to the place where there are no more categories. If you want the vaccine, go get in the line, no matter what your condition is. We can't live in categories. Categories is going to be restricting and it's going to be confusing. And as I said earlier, we're going to have to get rid of this paperwork. This paperwork is intimidating. And the computers, the technology, I have, as Judith knows, we have all these over 65 seniors. They don't know nothing about the technology. We had to get on the phone and help them fill out the application and do the computer things for them. We got to move the obstacles. And if they flood the zone, we won't have to worry about the Black community being overlooked. As long as it gets trickled out, the Black community will be excluded or not get our fair share. But once it's out there, everybody will have it. And so I think that's got to be our goal. That's what I've said to the president's people. I said to our governor, you don't stop acting like you have any other problem. You have one problem. Get the vaccines out. That's the problem. One problem. We got great mayors like our mayor, great health officials like Ms. Watson. We got great county leaders. Just get the vaccines out. That's the mandate. And if we do that, I promise you, this problem is going to go away. This problem is going to go away. We're not going to live in this space. Now, the space we are going to live in is the space of the consequences of the pandemic on the life of Black people. In healthcare, in economics, in education, our children are going to be radically behind when we get the vaccines, our children are going to be in serious, we were already behind educationally. That's going to be extended when we got the vaccine in our arms, our children will still not have the learning in their heads. Because the absence of technology, their families' capacity to teach, to compete with the white community that has a higher level of capacity when it comes to technology and our communities, we're going to have that. Then we're going to have these economic issues. These businesses, Black businesses are going to be in big trouble, and small businesses. And so the consequences of the pandemic, we ought to be focusing on as much as getting the vaccine. The vaccine, I promise you, is going to get done. But the consequences that the mayor has to deal with her tax base eroding, these are the things that we got to be organized to get done because the vaccine is going to take care of its own self.
And I'm glad you spoke about that, about the lingering consequences of
Yes.
COVID. And so we've been grateful. Mount Vernon and some of our leadership have been participating in a Harvard Bloomberg project for about 8 months now around the social and economic recovery of COVID. A lot of the tips that they gave us, we implemented. And so we were able to meet actually our sales tax projections for 2020. And that may not sound important, but if you're 10, 15% below what you projected, that's money not coming in to offer essential city services. And so we did a lot around COVID recovery and reopening of the community and education and resilience and continued compliance. And we've been able to help our businesses get back off the ground. In the next few weeks, we will be rolling out our COVID CARES small business recovery grants that we'll be giving out for up to $10,000 in the city of Mount Vernon. These are grants. These are not loans, to help some of our small businesses get back on their feet. We're trying to keep the bar low so that it's not very difficult. We are working with some of our local banks who are reinvesting in the community to help build the capacity of our businesses to reopen or to stay open as we come out of this vaccine. So, and I want to go back to you for a second, Reverend Richardson, because it was said earlier, just because it came through Grace, the only people who got vaccines were not from Grace. And it wasn't just Black people. There were people 65 and older. And I went there over a 2-day period, and I saw white residents, I saw Spanish residents, I saw Black residents, everyone over 65. So, through your efforts and through the efforts of the health center, I know that with the very short time, because you had about 48 hours,
Right.
if that, 36 maybe, to kind of put this together. Like you said, it was a pop-up site. And when we said pop-up, we meant pop-up. They said, we have vaccines available. You said before, they called and said, we have 500 vaccines available to give to you over a 2-day period. They called later and said, no, we have 250. You said, absolutely not. You said 500, deliver 500. And so you had to fight and you had to advocate for the little that we got. Because right now, the pie, it's not even a pie, it's a slice of a pie.
No, that is like
Everyone is fighting on it over, and that's why you're talking about flooding the zone. But I want to commend you. I want to commend Grace. I want to commend the Mount Vernon Neighborhood Health Center for working together. I saw you reach out to all different types of stakeholder groups to reach our seniors, because that was just for people 65 years and older, to reach them, and people came in. And I know you have more than 1,000 people on the waiting list who've reached out because of that effort. As we said, back in November, December, and early January, we were talking about vaccine hesitancy. But so many educational efforts have gone on in between then and now that now people are clamoring. They're clamoring, and we want to make sure that we are meeting that demand, that we're meeting that need. And what we're trying to explain to people right now is we're waiting on supply. There was no big supply when Biden walked into the office. There were no warehouses full of vaccines. And so they're ramping those up now. And within the next month to 5 weeks, they will start coming down more through the state. I know the health center, as a federally qualified health center, Mount Vernon Neighborhood Health Center not only runs the Mount Vernon Neighborhood Health Center, but Yonkers Health Center, Greenberg Health Center. You do the health center up in Valhalla at several of the homeless sites, school-based sites. So you have 8 different sites. And so as a federally qualified health center, you'll be receiving some of the vaccine doses directly as well. Is that correct?
Yes, Mayor. And there are 2 things, as you all were speaking, and Reverend Richardson, that was so well stated. I could just listen to you all night long. So I'd be remiss if I didn't mention 2 things. One is federally qualified community health centers operate throughout the United States of America. And here in the state of New York, there are about 90 federally qualified community health centers. And we serve the population that needs this vaccine more so than anyone else. And so I wish Mr. King was still on so that I could say this to him, and he probably already knows this, and I'm sure that Reverend Richardson and you, Mayor Patterson, will convey it as well as you can. The health centers we have the solution. We have the solution. We have the infrastructure. We've been doing it for 50 years. The patients know us. The patients trust us. This is where the folks who are dying disproportionately come for their care. So why not flood these federally qualified community health centers with the vaccine so that we can partner with the churches, the other trusted partner in the community, their home in the community, so that we can partner and we can get our folks vaccinated.
But they can't give you vaccine. You need them to give you bodies, money to get bodies so that you could administer these vaccinations. See, I didn't want you to have to say that yourself. Thank you. Thank you for taking on the testing site. Yes, they bought you test kits and they paid for the processing, but they didn't give you any extra staff. And so you are testing hundreds of people while running a full-time federally qualified community health center. And so if the federally qualified community health centers are now to become vaccination distribution sites, that must also come along with money for you to be able to hire staff, pay the staff that you have extra, or bring in additional bodies so that we can really, really get this moving. The quicker we get people vaccinated, the healthier our communities become, the more our economy can open, our economy is able to open back up, and we're able to get to, I don't want to even say normalcy, because whatever our new normal is going to be is what our new normal, but it's going to be able to reduce the risk of transmission. And Rev, you said it, we have to eliminate the categories. Because in my house, we're different categories of people. Your house is a house. Yeah. And when we're talking about the spread of the virus is happening in people's houses now, more than it's happening at work or at school and at gyms, it's happening in your house. So if, I am eligible now as of tomorrow because I have high blood pressure to go get it. My husband is eligible because he has a comorbidity. But my daughter is not eligible. She lives at home. She's 29. She has no comorbidities. So, what do? We go get it and she doesn't get a chance to get it and she gets positive. So we don't live, like you said, we don't live in categories. So we have to find a way to flood the market and make sure that everyone is accessible. And I'm sorry, Judith, you had another thing, but I wanted to make sure we were getting your resources.
Oh, no. I think that equally as important as having the vaccines, to Reverend Richardson's point of flooding us with the vaccine, is also flooding us with the necessary resources. Ken, you already know this. We've tested close to 20,000 people at our Mount Vernon Health Center site. And as the mayor said, we have the PPE and the tents out back that's taken care of, but it's the health center that provides the staffing resources. I don't have to tell you how expensive that is. We're taken away from our operation, but we believe that not only is it our moral obligation, but it's our mission to ensure that our residents get tested. And it's also, we feel the same way about this vaccine, but we need the resources. We're happy to take the lead, just as we did with the COVID testing, and it's a walk-up site in Mount Vernon, because not all of us drive, right? So it's a walk-up site. We wanted to ensure, and the mayor advocated for that. Thank you, Madam Mayor. You are a phenomenal leader. Now we need to get our community vaccinated, but please give us the resources that we need.
Let me say that there is money in the new stimulus package for health centers. We got to lobby our national congressional people in this state on behalf of Mount Vernon Health Center, the governor, and anybody we can to make sure that we get our fair share of the money that's in the package. It's going to be passed in the next couple of weeks. There's money there to take care of that. I also want to say that I'm very thankful for the partnership that we've had with the health center. I think it is a powerful model that these two serving institutions coming together for the good of our community, that can be replicated all across America with a mayor who's sensitive and on top of it. These kind of partnerships make this doable. History will write that people stood up and took responsibility for their future, that leaders who do lead will be credited with getting us through the darkness of this hour. And I want to thank you, Mayor, for what you've done. I also want to take and parenthetically say that I'm very concerned, and this is not, I know that I've been a leader now for almost 60 years. And I know it's hard being a leader. And I want to say, and you know, Mayor, and people always make an explanation, but I want to step up real quick. And I have nothing to gain from it. But I want to step up and say that the heat that Governor Cuomo is taking about these health centers these senior centers is unjustified. The governor has stepped in and provided leadership for this state that's unparalleled to any state in this country, and that the governor's persistence gave us comfort during those dark days when we couldn't get any information from the president or the federal government. And now at the end of it, people are going and exaggerating his. And nobody wants nobody to die. You know the governor don't want nobody to die. He laid his life out for all these months trying to be a healer. So I just want us, as a community, we have got to lift our leaders. Our mayor, she's doing all she can do. We got to lift them. We got to stop this mentality of tearing down the people who are leading us. That's a self-destructive thing that's going to destroy us as a people. And so, county legislator Ken's been in this struggle a long time. So I wanted to say that. I know, man, that ain't a part of this conference.
I mean, we're having.
Wait. You know something, though, man. And Rev, Rev Richardson, you are hitting all the points, and Judith as well. The two things is because the ability to have that kind of conversation with the governor. In the county executive Latimer, our team, Joe McDonald, our whole team has been in all of these constant conversations, and we've been able to be flexible, Judith, as you've been talking about, because of the kind of leadership that Governor Cuomo has had through this process. And as you said, Rev, there's some Monday morning quarterbacking going on right now.
Yes.
And being able to get the statistics and say who died in category A or category B, doesn't matter. They still died. And we did everything that we could do to not have that happen. And, in conversations that we've had, people need to go back because everyone wasn't in the game as deeply in March as we were here in Westchester, specifically in the county. Understanding, watching in Elmhurst Hospital when people were in the hallways and ICU dying because of that, and the governor taking that leadership role and making regionalized hospitals and being able to say, you know what, if you're not that sick to be in the hospital, we need to send you either home or to a hotel to be able to convalesce, or in some cases back to your nursing home in a kind of area. So you're right, Reb, we should be lifting up people like our mayor here, Mayor Shawyn Patterson Howard, and all of the folks that have been doing this. I sit in the meetings with County Executive Latimer, and we've been having these conversations, and people all want to have the same thing, and it's frustrating, right? It's very frustrating because, as you said, right now the matter is there's just not enough vaccine. So I think, I was talking with Mayor Shawyn Patterson Howard about that when the additional folks were expanded. I said, oh, that's 4 million more people who won't be able to get a vaccination, right? And will be frustrated, et cetera. But the governor has been able to lead and steer through this process. And that's why we've been able to target vaccinations. And it's not enough. We know we need more. But guess what? We have some, and we have the ability to have that voice. Reverend Richardson, to be able to call and say to the governor directly, how can we do that? And because of the partnership with the Neighborhood Health Center, with Judith Watson, and the faith-based organization, but Grace Baptist Church and your leadership with Reverend Sharpton, all those kind of things, to get the vaccines to where the mayor has been asking us to get to them, to the individuals. And we got to keep doing that. So Mayor, you brought up another point earlier, and I just want to echo that again. We need to make sure that people are ready. Now, you should always try to get an appointment online, no matter how navigation difficult it is. Our county Department of Senior Programs and Services, May Carpenter is our commissioner there. County Executive Latimer directed them to say, let's make a hotline to help people make the appointments. So we've been doing that, as well as Mayor and all of the folks in the community, been trying to do everything possible. Rev, I know that you have your ministry and your senior ministry out there trying to help all the folks do whatever they have to do to be able to get those appointments. But if you have this opportunity, and as you said, 36 hours, I think that might be a little bit of too much time that people have gotten. I know we got a call at the last day on the pop-up site, because people forget it was a snowstorm on that Sunday for us. And they said we're going to move those appointments to the day before, which was smart because of the intensity of the snowstorm. But we had a phone call that said, you know what? There's 100 vaccinations left, and we need to get folks to them. And we were able to reach out to those folks in the community to say, look, let's call this pastor, let's call this organization head, and say they have 100 vaccinations left. Get there, and if you get there, they're going to inoculate you and vaccinate you. So the thing that we can do now, Mayor, all those organizations that you ticked off, those fantastic partners that you have in Mount Vernon, they should be preparing those kind of lists. And that doesn't say, again, don't stop trying to get that appointment wherever you can get it. And Rev, you said this as well. People go wherever they have to go. On the website right now, because people complained about it, there's 2 sites I think still left in Potsdam and in Plattsburgh. All of those are 3 and 4 hours away, and people are still driving up there to go get them. But right. Again, get the list ready now. So when Judith Watson calls your church or calls the mayor and says, Mayor, we need another 50 people, and they call the church and say, hey, we need 10 people from you now, not tomorrow, not next week. I mean, I know I'm still getting emails from people from the Yonkers pop-up site that said, hey, I'm interested in getting the vaccination. I'm like, that was 2 weeks ago. Where were you when we needed that to happen? So again, keep focused on that. But again, we got to keep saying this, Rev. And you're right. We have to hold up our leaders. We need to have people be accountable for things, but that doesn't mean we're tearing them down when we're just asking questions and not Monday morning quarterbacking and saying, well, why didn't you do this, 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 and this, right? Mayor Shawyn Patterson-Howard is an outstanding, great, and fantastic leader that's been out there trying to do everything possible to get more vaccine sites in the city of Mount Vernon, right? But that doesn't stop anybody else from saying, oh, well, she didn't do this. It's like, stop.
So
we're working as hard as we can.
And I want to address that because it's not about me. What we've talked about this entire time is the national rollout has been slow. Vaccines just were not created at a high enough rate. It hasn't been sent to the state and it hasn't been distributed. And so what I need people to do, whether it's Mount Vernon or it's any other communities, we have to stop tearing and dividing our own communities down. I'm looking at comments on the Facebook page as Ken was speaking, and people are saying, well, what about a pop-up site on the north side? We're working on putting a pop-up site on the north side, whether it's at a school, in a parking lot, the high school. This was one pop-up site. We had one pop-up site because Dr. Richardson and Ms. Watson both sit on the governor's New York State Equity Task Force. They came in and they asked them to create a site. They put a site together within 36 hours to give out 500 doses of vaccines. Those seniors who received the vaccine lived on the south side. They lived on the north side. They were poor. They were wealthy. Some lived in public housing. Some of them paid $20,000 in taxes a year. So everyone, we have to stop it. I understand that people are anxious, but we cannot give you vaccines that we do not have. But what we are saying that we are looking to do is we are creating the list of people who want to be vaccinated. So if you're interested and you have a loved one who is interested in being vaccinated and you have not been able to find a site as of yet, through the health center or through the county center where the county's doing it, or the Westchester County Department of Health, then you can contact the Mount Vernon Neighborhood Health Center at 914-699-7200, 914-699-7200, and get your loved one on that list. So when we have the next event, we're able to pull from that list when we have our next pop-up, because we might have a pop-up before the zone is flooded with sufficient vaccines. You can also call Grace Baptist Church at 914-664 2676, 914-664-2676. Our Westchester County Department of Health at 914-813-5000, 914-813-5000. And then we're also utilizing our recreation department, because our recreation department has kind of led our human services effort. We used some of our different departments, like the recreation department, the youth bureau, office of the aging, and veterans, to kind of create our human services division within the city of Mount Vernon. And so they're leading that effort. And the recreation department is 914-665-2420. Yes, some people have to go to the Bronx. Yes, other people are driving 100 miles. The vaccines just don't exist at a high enough level. Trust me, if we could have the vaccines given out on the steps of City Hall and 25 locations in Mount Vernon, we would do that, but they don't exist at this time. And so what we're doing is we're organizing, we're finding out who's interested and making sure that we're able to pull them and direct them where they need to go as we find that vaccines are available. The other part of the conversation that we're having nationally is that Walgreens and CVS and locations like that will become vaccination sites. So as of right now, there are 27 CVSs in the state of New York that are giving the vaccines. The challenge is that none of them are in Westchester right now. So we're still waiting for there to be the CVS stores in Westchester. We do have a CVS in Fleetwood, and we have a CVS on Sanford Boulevard. So both on the north and the south side. I'm very anxious and waiting for those to be opened. I've been in contact with their store management already, trying to find out when that's going to come so that we can be prepared and make sure, again, that it is our Mount Vernon residents that are accessing these vaccination sites. So, you know, Rev, I'm going to have to bring you back on, because we need to talk about your book, because you have, you know, your book. And in the epilogue of your book, you spoke about the pandemic, and you spoke about the fact that you believe that this has almost been a reset, that it's helping us to remember that we are our brother's keeper, and that it's bringing the compassion back out in our community, and the selflessness in our communities back out, because we've seen people come together as never before in the midst of this. And so can you give us about 2 minutes on how this pandemic has changed the way that you're ministering, the way that you're leading, and the way that you're serving?
Well, we entered the pandemic in a real difficult space. Our lives were turned upside down. And the questions become, what's going on, God? It's a global pandemic. It's not just a city or a state. It's a global pandemic. Is it that God is calling us to reset, to rethink? And we talk about going back to the normal. No. This pandemic ought to move us beyond the normal. Not just a new normal, but a whole different understanding of who we are in relationship to each other. The pandemic has showed us that the boundaries that separate us, whether they are national or state or race, are fake. The pandemic just rolled right on past all the boundaries, the walls we put up, the societal walls, the psychological walls, the social walls we put up. The pandemic went right on by it. And does it not affect us to understand that the only people who were affected, the only element of the creation that was affected by the pandemic were human beings? The dog's still barking, the cow's still moving, the sun's still rising, the moon's still dancing, and we human beings are the ones who were tapped by the divine's hand. And we have to ask this. We deal with the practical and the existential issues. We must also deal with the spiritual issues that are attached to what is going on in our society. As we respond, maybe we'll wake up and see that we are all one humanity, that we're all brothers and sisters. Maybe we'll wake up and see that we have accountability. And we saw in this pandemic the marvelous display of compassion, of caring, people putting their lives on the line in the hospitals, in the nursing homes, in the cab drivers who were driving people to the hospital for free. I mean, we saw compassion. We saw people feeding. We saw breakout of shelter for people. So it's been some good things have come out of the pandemic, and it's been a time of introspection. I hope that we will not miss this moment to become better, not just to be normal, but to become better.
Thank you so much, Dr. Richardson. And with that, we're going to close out Please go out and get Dr. Richardson's book, Windows to Grace. We are resetting. We have an opportunity as humanity to reset, to demonstrate compassion, and let's not fight each other over a limited amount of vaccinations. Thank you, everyone. God bless you. Take care. Stay in here for a minute as we disconnect, and take care, Mount Vernon. God bless.